Hey everyone, it's Dr. Jen, board certified pediatrician, coming to you today from my office in Manhattan. And I'm excited to talk about today's topic because parents have been asking me all about the topic today, and it's about measles, what you need to know as a parent to keep your child safe and to protect them in 2019 here in the United States. Because in case you haven't heard, since it's all over the news, that there are outbreaks all over, particularly in New York and in Washington State as well too. So I think it's really important to know about measles, what it is, how to protect yourself, how dangerous it may be. And I know I took a little poll on Instagram, and I had a lot of replies, and it was about 50-50. My question was, are you concerned about measles in your child? And about 50% of the moms said yes, and 50% said they weren't. So I'm hoping the ones that weren't concerned was because their child was vaccinated, and we'll talk about the vaccine and how effective it may be. And if you are concerned, I'm going to give you information to maybe ease your mind and to tell you what you can do to help prevent the spread of measles to your child and in your community as well too. So I know, as I said, I know it could be really overwhelming because, right, you're hearing on the news and on the internet, and you may be reading it in magazines, and your doctor may be talking about the outbreaks of measles that are happening around the country. So let me give you some tips, advice, and some facts as well too. So first of all, what parents need to know is that measles is very contagious. It's not a little contagious, it's extremely contagious. And you may not know that. But if you actually are around someone that has measles and you're not immune, meaning that you haven't had the disease yet or that you have not been vaccinated, you have a 90% chance of getting measles if you're around someone who has measles. Now, if you go, so that's like if you go into a room with someone who has measles, but guess what? You don't even have to be in the room with them. If they were in a room and they've left the room, and within the next 2 hours, you enter the room with someone who has measles, and they, again, may not even know that they have it yet. I'm going to explain that in a minute too. But if you were just in that room, even if after they left, you are exposed and you have a 90% chance of getting measles. It is airborne, and so you can get it from droplets from the air. You can breathe it in. If you touch your eyes, your nose, your mouth, if you touch anything in the room that someone who has measles has touched, again, you can get it transferred that way as well too. So it's extremely, extremely contagious disease. What also makes it really contagious is that a person who has measles, they may not know it because they're contagious 4 days before they even have any symptoms, until 4 days after they have the rash. So that's a pretty long time, but 4 days before they even have any symptoms, right? So you can be walking around, you can be traveling, and not knowing that you're infecting people by talking and coughing and touching things that they may then come into contact with. And in addition, it has a long incubation period as well too. So it's 7 to 14 days. So you may not know, you may be exposed to someone and then you may not be ill for about 2 weeks after that initial exposure. So that's how it keeps on spreading from person to person, because many times it's spread before the person even has any symptoms. So they may be on public transportation, out and about, out at work, around children, where it can also spread. So the other thing that it's important for you as a parent to know is that measles can be really serious. So you may have heard that from some people may say, oh, it's just a childhood virus, a fever and a rash, nothing to worry about. Well, that's not really true. Let me first go through some of the symptoms. So first of all, it starts with fever, runny nose, cough, like many other viruses, watery eyes. And then a couple days in, you often get some white spots in the back of your throat, which sort of is a sign that the rash is coming. And then children usually get a rash. It starts on their head and neck, like red spots. And then it sort of sometimes coalesces, which means lots of red spots together, more looks like red blotch areas as well too. Some of the red spots can even be raised on your chest and on your back, as well on your arms and your legs. And usually the child is pretty miserable, and they usually have high fever. 104, 105 is pretty normal with measles. And again, I know it, and I've talked on this show about fever so many times, but parents get freaked out about fever. So if your child even is otherwise okay, but they have high fever, 104, 105 for days, obviously they're feeling miserable. And parents obviously are very concerned. Fever can also cause dehydration as well too. So those are just the sort of early signs of the virus. But as I said, it can have severe complications. So it's more severe for children under the age of 5 and also for adults as well too. Common complications that kids get with measles is ear infections and diarrhea, which again can lead to dehydration. For severe complications, often 1 in 4 are hospitalized. So that's a lot. 25% of people with measles end up having to be hospitalized. And pneumonia, 1 out of 20 people who get measles, particularly children, and it's the most common cause of death in children from measles, is pneumonia, and they often need to be hospitalized for that as well too. And in addition, 1 in 1,000 get something called encephalitis, which is an infection or swelling around the brain, and that can lead to convulsions or seizures. And in addition, it can end up long-term sequelae or resulting in intellectual disability as well too. So it can be long-term effects too. It can also cause hearing loss, measles as well too, down the road as well. So it's also important to note that 1 in 1,000 that get measles often die of measles as well too, complications. So as you see, it can be really severe, and the complications can be life-threatening and even cause death. And when the numbers are low, you can say, oh, well, it's not really that many. But if you remember, before they even had the vaccines, before the 1960s, millions of people in our country each year got measles, and then there was thousands and thousands that were hospitalized, and then it went on to have severe complications as well as deafness, seizures, as well as I said, intellectual disabilities as well too. So you also have to be careful if you're pregnant. So it's important to be fully vaccinated before that you become pregnant, because it can cause preterm labor, and it can cause babies to be born early, which also comes with a whole set of complications for premature babies as well too. So yes, measles can be very, very serious. It's extremely contagious. And yes, you can still get measles in the United States. And how and why? Well, there's a few reasons, but first of all, because people have been choosing to not vaccinate for many different reasons. People are not vaccinating, and that is bringing then the vaccination rate down, where there's now pockets of particularly children who are at risk then of getting the disease and then spreading it. And the disease is rampant in other places around the world. And when people go on vacations or people come into this country, they then even unwillingly and unknowingly bring the measles virus with them, because again, they may not be show any signs for about 4 days, and they are contagious before they even show any signs. So we're seeing lots and lots of measles outbreaks in Europe. So Spain and England, we're seeing it in Israel as well too. I just read today in the Philippines there's a huge measles outbreak, and there's been 55 since January, the beginning of the month, 55 deaths in children under the age of 4. And so again, people are bringing it into this country as well too. So it's important for us to keep our vaccination rates up. This is a disease that's totally preventable. We know because it's been what we consider eradicated in this country in about the year 2000. And so, but now we're seeing this comeback because people really didn't think about it, didn't want to worry about it, because they said, oh, there's no risk of me getting it. We haven't seen measles. But as I said, as the vaccine, as people don't get the vaccine for their children, then when the measles is brought into the country, it spreads like wildfire. And it spreads quickly. It really spreads quickly when we have vaccination rates under 90%, even under 95%. But because the measles vaccine is so effective, when it gets down to about 90%, we sort of lose that herd immunity, and it can really spread quickly. And that's what we're seeing in different pockets right now, in that Washington, Oregon, and even in parts of New York State as well too. So what can we do to help prevent this? Well, first of all, I think it's important for parents to know the vaccine is safe and it's very, very effective. It does not cause autism. I just have to say that over and over, because people, you're seeing it online, internet, but the vaccine, the measles vaccine does not, the MMR does not cause autism. It does not cause any type of disability. All it does is prevent you from getting measles. And it's very effective. The two, you usually get 2 shots. You get 1 shot and then you get a booster. And the two combined have a 97% giving you immunities, which is amazing. And we know that if you happen to still get it, then you have a much, much milder case. And that's what we want, right? We want kids to not get measles, but if they get it, obviously we want a not as a severe case, and to really decrease any complications or hospitalizations. So we can prevent it by making sure that kids are vaccinated, that we know that to vaccinate kids in this country, we get, as I said, 2 vaccines. One is usually between ages 12 to 15 months of age, and then another one at 4 to 6, usually the time when they're entering school. But what parents may not know is that those 2 shots can be given within a month of each other. So if you are in a high-risk area, speak to your pediatrician. You may want to get that second vaccine earlier. I do recommend that. And also, if you're traveling, so if you're traveling outside the United States and you're going to Europe or you're going on vacation, and your child has not had their 2 vaccines, the 2 MMRs, I highly recommend that they get both of those. If they're trying to a really high-risk area and they're under the age of 1, they still can get vaccinated, and they should if you're going to a high-risk area outside the country. And then they still need to get their 2 boosters, one between 12 to 15 months, and again, the second one when they are between 4 to 6. And that's the best way. I mean, really protecting your child by giving them the MMR vaccine, the measles vaccine, is the best way to protect them, by giving them the immunity that they need, and helping, again, also to protect those others in your community that may not be able to get the vaccine, for those who have weakened immune systems, who have cancer, and who are on immunosuppressives. There's a whole host of medical reasons why someone may not be able, or a child may not be able to get the vaccine, besides being too young for it. So it's really, really important to protect yourself, your child, family, schools, everyone can do their part by protecting each other by getting the appropriate vaccines. So this is Dr. Jennifer Trachtenberg. I hope I answered all of your questions. I tried to answer all the questions that were asked of me. If you have more, please leave them below, and I will respond. Thank you so much. And again, it's really important to make sure that you're up to date. So make sure that you have your yearly checkups with your pediatrician. Any questions or concerns, speak with your healthcare provider. It's Dr. Jen, and I will see you again next week. Thanks.